As a home care aide, you are doing important work. By helping people live in their homes with dignity, you provide an essential service. In the past, institutions primarily delivered care to older adults and people with disabilities. Now, Washington State is leading the nation and creating the model for home care. The daily living support that you provide makes it possible for consumers to direct their own care while staying at home and in their communities. You may often work one-on-one with your consumers, but you are also a part of something bigger, a growing movement of home care aides. In fact, you are a part of the fastest growing profession in the country. With 8,000 people turning 65 every day, Washington State will need over 440,000 HCAs in the next 15 years to meet the demand. That's 10 times more than today. That's why we're here to help. The SEIU 775 Benefits Group is a nonprofit formed by participating employers, including the state of Washington, and SEIU 775. We've built a program that trains over 40,000 students in 13 languages, online and in person, with classes across the state. With this program, Washington State leads the country in certification standards, training, and professionalization of HCAs. With paid basic training, continuing education, and the registered apprenticeship, we want to help you build skills so you can deliver high-quality care for the long term. Through this program, you can increase your wages and have a successful career in healthcare. That's why we want to help you provide the best care possible. To do that, the Health Benefits Trust gives you what you need to be a better home care aide. We believe that care begins with you. We found that an increase in self-care can lead to better care for your consumer. You have to take care of yourself in order to take care of others. To support your self-care, we provide access to preventive care, mental health care, dental care, and care for unexpected or unplanned events. We're here to help you get on a path of ongoing health care. With the Secure Retirement Trust, we can help you start saving for your retirement. The SEIU 775 Benefits Group is here to help you care for yourself, build your career, grow your skills, access health care, and save for your future. As a home care aide, you provide an essential service, and we want you to continue to do the important work that you do. We want you to have a healthy life and healthy future because ultimately, you are a key piece of the healthcare system.
Welcome to the Orientation and Safety course. This video provides instructions for using these DVDs. The Orientation and Safety course has 5 modules on 3 DVDs. Each DVD will hold up to 2 modules, so you will have to change DVDs after modules 2 and 4. To pause or stop the DVD, use the pause or stop buttons on your DVD remote. During the DVD, you will be asked questions to check your knowledge. During these questions, a timer will appear on screen to show you how much time remains to answer the question. If you need more time, press the pause button. Press play to resume. If you have trouble using this DVD or have other technical issues, please call the Member Resource Center, MRC, at 1-866-371-3200. You should also know that this course is approximately 5 hours long. At the end of the last module, you will be tested on your knowledge. Let's begin now. Welcome to the Role of the Home Care Aide course. This is part 1 of the 5-part Orientation and Safety course. The first step to becoming a Certified Home Care Aide, or HCA, is taking this 5-part Orientation and Safety course. The purpose of this course is to provide an orientation to the home care aide's role. Make sure you have paper and something to write with ready, as you will be asked questions throughout each section of the course. Before you start, you will take a pre-assessment to see what you know about the job of a home care aide, HCA. This assessment is intended to help you understand what you need to focus on as you move through the course. Questions will appear on your screen. Choose the best answer or answers for each question. If you need more time to complete a question, pause the DVD. At the end of the course, you will be able to take another assessment to see what you've learned. Don't worry if you didn't do as well as you wanted. You'll learn all the answers as you move through the course. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. People have many reasons for becoming an HCA. Take a moment to write down your reasons for becoming an HCA. Take a few moments, you'll see reasons others wanted to become an HCA on the screen. If you need more time to complete the activity, make sure to press the pause button before time runs out. The first step of the journey to becoming an HCA is this orientation and safety course. The orientation and safety course is divided into 5 parts. This is the first module of orientation and safety. You will learn about consumers, what kinds of care they might receive, and about the job of an HCA. Documentation, the care plan, and reporting are also covered. You will hear more on this module in just a few minutes. The second module is about consumer rights, including the rights to privacy and confidentiality. You will hear about abuse and neglect and your role in reporting them. You will learn how to communicate with a consumer to promote dignity and respect. You will also learn about communicating with the care team and the consumer's family or guardian. The third module will show you how to prepare for emergencies, including fires, natural disasters, and medical emergencies. You will learn how to create an evacuation plan. You will also learn whom to contact in an emergency and what documentation to provide to the first responders. The fourth module will teach you about infections and how they spread. Using standard precautions will help you keep consumers and yourself safe from infection. You will also learn about washing your hands and how to put on and remove gloves. The last module will teach you how to keep consumers and yourself safe. You will learn about ways to make falls less likely and what to do if a consumer falls. You will also learn how to use proper body mechanics to avoid injury. You have heard some terms that might be unfamiliar to you. Before we move on, let's define those terms. You will see and hear them throughout each module. The consumer is the focus of the care team, the person who needs assistance. You may hear other words used to describe the person receiving care. Client, care recipient, and consumer are all the same person. This orientation and safety course uses the word consumer to describe this person. A long-term care worker is anyone working in long-term care. Long-term care workers may or may not be certified or licensed. A home care aide, or HCA, is a long-term care worker who has been certified by the Washington State Department of Health. You cannot say you are a home care aide unless you have completed all required training and the certification examination. The care plan is a written plan that outlines everything the care team is to do to support a consumer. The care team is everyone who provides care for a consumer, including professionals, relatives, and the person receiving care. Now let's see what this module will cover. By the end of this module, you will be able to describe the different types of consumer an HCA might support. Describe the places a consumer could receive care. Identify the basic job responsibilities and performance expectations of an HCA. Describe what a care plan is and how to use it. Identify members of the care team and describe how they work together. Use the observe and report process to report changes in a consumer's baseline. There are 5 lessons in this module. Lesson 1 introduces you to the Safety Orientation course and this module. Lesson 2 is about consumers, what care they might need, and where they receive care. Lesson 3 shows the job responsibilities and performance expectations of the HCA. Lesson 4 is about the care team and the care plan. Lesson 5 is about how to observe consumers, how and what to document, and what to report. In this lesson, you will learn about consumers. You will learn where they receive care and what kind of care they receive. As you learned earlier, the consumer is the person who is receiving care. Consumers are all ages and come from different backgrounds. Consumers may be children, adults, or older adults. Consumers might need care because they need assistance recovering from an illness or injury, have a disability, be aging, or are dying. Some consumers are cared for by family members. Some consumers might need care from an HCA because family and friends can't provide all the needed care. Because they come from different backgrounds, there is no typical consumer. Consumers who are unable to perform certain activities of daily living, or ADLs, might need care. Activities of daily living are the everyday personal care activities a person performs, such as bathing, dressing, eating, grooming, and toileting. Consumers might need this assistance because of physical disabilities, such as a spinal cord injury, developmental disabilities such as an intellectual disability, chronic disease such as diabetes, mental illness such as schizophrenia, or dementia. There are two types of personal care: activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs. As you learned before, ADLs are everyday tasks a consumer performs, such as grooming, moving from place to place, eating, or bathing. Instrumental activities of daily living, or IADLs, are routine tasks performed around the home or in the community, including meal preparation, grocery shopping, and housework. Not every consumer needs the same amount of care. Some might need assistance with only a few ADLs. Some might need assistance with many of them, and some IADLs too. Consumers can receive care in their homes or in residential care, such as an assisted living facility or adult family home. Consumers who need assistance but wish to remain in their homes may hire an HCA directly or through a home care agency. Other consumers might live in adult family homes or assisted living facilities. Adult family homes are neighborhood homes licensed to provide care for anywhere between 2 and 6 consumers. Assisted living facilities are larger residential facilities licensed to care for 7 or more people. This course is for HCAs who work in a consumer's home, so this course will focus on care in the home. Let's do a quick review of what you've learned so far. Decide if each activity listed is an ADL or an IADL. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement, then decide if it is true or false. If you need more time to complete the activity, make sure to press the pause button before time runs out. In this lesson, you learned that consumers come from different backgrounds. They can be any age from children to older adults. They could need assistance because they have a disability, are recovering from an illness or injury, or are dying. The type of personal care services they receive depends on their condition. Consumers get assistance with some or many of their ADLs, such as toileting or grooming. Some consumers may need assistance with their IADLs, such as going shopping or to the medical provider's office. Consumers may receive care in their own homes or in a residential facility. This lesson will teach you about the job responsibilities and performance expectations of an HCA. You will learn how to be professional and set boundaries with consumers. You'll also learn how you can best assist the consumers you work with. Your job affects consumers' lives and their ability to live independently, safely, and with dignity. Before you start this or any job, you should understand what is expected of you. Let's start by discussing the basic job responsibilities of an HCA. First, an HCA must be able to read and understand a consumer's care plan. An HCA must provide the personal care services written in the care plan and adjust the care to the consumer's preferences and needs, encouraging consumer independence and honoring a consumer's dignity, privacy, and individual differences. An HCA is also expected to observe and report changes in a consumer's baseline or normal health condition. You'll learn more about this later in this module. An HCA needs to be able to respond to problems and emergencies. This includes knowing when to call 911, your supervisor or case manager, and when it's okay to handle the problem on your own. How to handle emergencies and problems is covered in future modules. An HCA needs to be professional and present a professional attitude when assisting consumers. Part of this is letting the case manager or supervisor know when you are unable to care for the consumer, for example, if you are ill. An HCA must comply with all rules and regulations. This includes state and federal laws, as well as agency or employer policies. The HCA must also keep accurate time records as required by their agency and keep accurate records of the tasks performed at each consumer visit. Although basic responsibilities of an HCA are the same, certain HCAs might have other responsibilities, depending on who they work for. Let's start by talking about two types of HCA. An agency provider, or AP, is hired by an employer or home care agency. The HCA works with a supervisor. An individual provider, or IP, is hired by the consumer. The HCA works with a case manager. An agency provider HCA must know the employer's or home care agency's policies. The AP HCA must also let the supervisor know when there are changes that affect the consumer's care and other tasks listed on the care plan. An AP must also immediately tell the supervisor if the consumer dies, goes into the hospital, or moves to another setting. The individual provider HCA must take direction from the consumer or consumer's representative or guardian when appropriate. The IP HCA must understand the care plan that has been signed by the consumer or legal representative. The care plan may be translated or interpreted as necessary and as requested by the consumer. The IP must do the tasks in the care plan as the consumer directs and complete them in the order the consumer wants within the number of hours authorized. The IP must also let the consumer's representative or guardian, and case manager know when there are changes that affect the consumer's care and other tasks listed on the care plan. An IP must also immediately tell the case manager if the consumer dies, goes into the hospital, or moves to another setting. If the IP will no longer provide services to a consumer, the case manager must be notified in writing with at least 2 weeks' notice. Professionalism is how you present yourself. Being professional will build trust with consumers and others you work with. How can an HCA be professional? By being polite, respectful, businesslike, and doing what you'll say you'll do. Take a moment to think of some other ways you can show professionalism. You probably came up with several ways you can show professionalism, such as being positive, focusing on the task at hand, communicating clearly, being flexible, and being responsible. We're going to talk about 3 particular items: attendance, performance, and appearance. Consumers depend on you to provide care. It's important to be on time. Notify the consumer and call the supervisor or case manager immediately if you are going to be late, out sick, or need to take time off. While it's important to complete each shift, it's also important that an HCA doesn't expose a consumer to an illness. If you have a contagious illness, don't go to work. Some consumers are at extra risk from illnesses. If you are going to quit your job, give at least 2 weeks' notice in writing. A good HCA understands what is expected and focuses on the job while assisting a consumer. All tasks in the care plan should be performed efficiently and thoroughly. Knowing what to do can be more than reading the care plan. If you work for a home care agency, your employer might have policies and procedures regarding care that you need to know to do your job. Check with your employer to see what policies and procedures you need to know. An HCA regularly performs tasks that are highly personal, requiring a large amount of trust from the consumer. A way to build this trust is to make sure your appearance shows your professionalism. Taking care of your appearance means practicing good hygiene and grooming. Hygiene is being clean and sanitary. Grooming is taking care of your hair, teeth, and nails. Here are guidelines for grooming. First, take care of your daily personal and oral hygiene. Wear clothing that is clean and comfortable. The clothing should be easy to move in and something that is easily washed, as you may come into contact with a consumer's body fluids. Wear closed-toed, flat shoes. This will help prevent injury to both you and the consumer. Your hair should be neat and out of your face. Make sure your nails will not injure a consumer by keeping them short and filing them. Consumers have certain ways they want things done, but this doesn't mean the HCA should do everything a consumer asks. This is why it's important to set professional boundaries with a consumer. A professional boundary is appropriate limits in a job relationship. Setting boundaries ensures the HCA is performing only the tasks listed in the care plan. How does an HCA set boundaries? First, remember that being an HCA is a job. This will help you balance work and your family life. Second, remember your relationship with the consumer. An HCA should not discuss personal information with a consumer. Last, make sure you understand the care plan. You may say no to requests that aren't listed in the care plan. You've learned about the job responsibilities of an HCA, professionalism, and setting boundaries. There are many other qualities a good HCA has. Take a few moments to write down things you think would make a good HCA. There are many qualities of a good HCA. You may have others on your paper. Friendly. An HCA should be friendly to the consumer and other members of the care team while still maintaining professional boundaries. Patient. An HCA assists a consumer in doing tasks the way the consumer wants. This means being patient when identifying the consumer's choices and preferences. Respectful. An HCA needs to respect and honor individual consumer differences. Good communicator. HCAs need to communicate effectively with consumers and the care team so the HCA can understand the consumer's needs and preferences when providing personalized care. Works well with others. An HCA has to work with the care team to give the best care. Observant. HCAs must watch consumers for changes in their baseline and report them appropriately. Good listener. HCAs must listen carefully to consumers to provide personalized care. Caring. HCAs care about the consumers they work with and about doing their job well. The ultimate role of an HCA is to assist consumers with their ADLs so they can remain independent and in their own homes. An HCA gives the best care to consumers by following the basic job responsibilities, being professional, setting boundaries, and showing qualities of a good HCA. All of the job responsibilities might sound overwhelming, but being an HCA is a rewarding job. Take a moment to think of a few reasons you think you will like your job as a long-term care worker. If you need more time to complete the activity, make sure to press the pause button before time runs out. Sample answers include: like working with people, like helping people, helping make others' lives better, knowing the consumer is safe and happy, helping people improve their health and independence. Let's review what you learned in this lesson. Read the statement, then decide if it is true or false. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement, then decide which is the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. In this lesson, you learned that there are two types of HCAs in the home care setting: agency and independent providers. APs work for an agency or employer. IPs work for the consumer or the consumer's representative. Both types of HCA have the same basic responsibilities: being professional, keeping accurate time and task records, providing personalized care according to the care plan, knowing what to do in an emergency, and observing and reporting changes in a consumer's baseline. Ways for an HCA to show professionalism are to be on time and call if they'll be late, take pride in their jobs, and to have a professional appearance. HCAs need to set professional boundaries with consumers by remembering being an HCA is a job, not sharing personal information, and saying no to tasks not in the care plan. This lesson will teach you about the care team and the care plan. You'll learn about the members of the care team and the HCA's role in it. You'll also learn what the care plan is and how to use it. The care team is the group of people who provides care for and support the well-being of a consumer. The care team is made up of several people. Who is on the care team depends on the consumer. Take a minute to think of some people who might be on a consumer's care team. If you need more time to complete the activity, make sure to press the pause button before time runs out. Consumer, consumer's guardian, legal representative, HCA, doctor, nurse, supervisor, case manager, social worker, physical therapist, speech therapist, occupational therapist, mental health professional, dietitian, consumer's family, consumer's friends. An HCA will know who is on the care team by looking at the care plan. If you remember from earlier, the care plan is a document that lists the services and support a consumer needs, and when and how the consumer would like them to be completed. An HCA must read the care plan to know who is on a consumer's care team. You'll learn more about the care plan in a few minutes. The consumer is at the center of the care team. The care team supports the consumer. Other members are the HCA, the case manager or supervisor, medical professionals such as a doctor or nurse, a therapist such as a physical, speech, or occupational therapist, a mental health professional, and the consumer's family or friends. It's important to remember that the consumer has to give permission for friends and family to be on the care team. People not on the care team cannot be told about the consumer's medical or financial information unless the consumer gives written permission. An HCA might spend more time with a consumer than the consumer's friends, family, or other members of the care team. This means the HCA is able to observe and report changes in the consumer's physical or emotional health. The HCA uses the observe and report process to let the appropriate members of the care team know about changes in the consumer's baseline. You will learn more about this in the next lesson. You learned earlier that the care plan is the written assessment that lists what personal care services a consumer needs assistance with, including who is responsible for those services and who is on the care team. The care plan also gives the HCA instructions for each task, along with the consumer's strengths and limitations. The care plan describes the consumer's condition and general health information. Examples would be what, if any, diseases or conditions a consumer has, how they're being treated, and information such as the consumer needing hearing aids to hear. The care plan is important in helping the HCA understand the consumer's baseline. The baseline tells members of the care team what the normal level of functioning, physical, emotional, mental, and social, for a consumer is. The HCA must carefully read the care plan to understand the consumer's baseline. You can also learn about a consumer's baseline from other care team members and from the consumer themselves. When an HCA observes changes in a consumer's baseline, the HCA must report them to the case manager or supervisor. This is an important part of the job of an HCA. Examples of things an HCA should report are changes in a consumer's skin, vision, color, and pain level. You'll learn more about this in the next lesson. Although the HCA is responsible for knowing what is in the care plan, the HCA does not create the care plan. The care plan is created by a case manager and the consumer. The case manager will talk with the consumer to see what assistance the consumer needs with personal care. Then, the case manager will assess the consumer's ability to do each task. The written assessment is the care plan. The HCA must read the care plan to learn about the consumer and their personal care. If there is no care plan, ask the case manager or supervisor for a copy. The care plan is meant to help all the members of the care team understand what the consumer's needs are. An HCA must understand the care plan to make sure the consumer receives consistent care that meets their needs. If you, as an HCA, do not understand any part of the care plan, talk to the case manager or supervisor for an explanation. Even though the care plan helps an HCA to know what tasks need to be done, the HCA still needs to talk with the consumer to learn their preferences. The HCA should ask questions about how and when to do each task. You'll learn more about this in the next module. Let's review the topics covered in this lesson. Read this statement, then decide if it is true or false. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide if it is true or false. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read this statement, then decide if it is true or false. If you need more time to complete the activity, make sure to press the pause button before time runs out. In this lesson, you learned that the care team is the group of people who provide care for and support the consumer. The care team may be made of medical professionals, the consumer's family, therapists, mental health professionals, and a case manager or supervisor. The care plan lists the members of the care team. The HCA's role is to read the care plan to provide consistent care to the consumer and to observe the consumer for changes in baseline. The care plan is a written assessment completed by the case manager. HCAs should ask the case manager or supervisor for help understanding the care plan. In this lesson, you will learn more about the observe and report process. This lesson tells what you should be looking for and to whom you report changes in a consumer's baseline. You'll learn about using problem solving to work with consumers. Lastly, you'll learn about documentation, what, how, and when to document. As an HCA, you spend a lot of time with the consumer. You could be the first to notice changes in a consumer's physical, mental, or emotional health. It is your responsibility to observe consumers and report any changes or concerns efficiently and quickly to the appropriate care team members. This is especially important because different members of the care team might not see the consumer regularly and will need to know about any changes in the consumer's baseline. The first thing to know when observing a consumer is what their baseline is. Let's check to see what you remember about the baseline. Read the statement, then decide which is the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. An HCA should always be alert for any changes in the consumer's baseline. An HCA should use their senses of sight, hearing, smell, and touch as they care for a consumer. An HCA should be aware of more than just changes in physical health. Look for changes in emotional or mental state. This means listening to the consumer and watching their moods. Physical changes may be the easiest to notice. Examples would be changes in the ability to stand, move, or do self-care, signs of pain, weight loss or gain, changes in grooming such as body odor or dirty hair, symptoms of illness such as cough or fever, and changes in skin such as rashes or pressure ulcers. Mental changes to look for are things such as confusion, forgetfulness, lack of cooperation, loss of interest in activities, saying things that don't make sense, or paranoia, thinking people are out to get them. Any of these changes could be the sign of an illness or injury. You will have to pay close attention to a consumer and to what the consumer tells you to see emotional changes. Look for changes in mood, such as crying, being more quiet than usual, showing signs of anxiety, extreme grief, or being afraid. You'll also want to listen if the consumer asks you for help or discusses concerns with you. If the consumer talks about suicide, don't delay. Call 911 immediately. If you observe signs of or suspect abuse or neglect, you must report it immediately. Signs of abuse could be unexplained injuries, being extremely fearful, or someone not allowing you to see the consumer. You will learn more about signs of abuse and neglect and what to do if you observe them in the next module. Observing is only half of the picture. If you see changes in a consumer's baseline, you must report them. To whom do you report? An HCA reports changes in baseline to the supervisor or case manager and other members of the care team, if appropriate. These people can determine if the consumer needs treatment. However, if the consumer is in immediate danger, call 911. You can report the incident to the case manager or supervisor after making sure the consumer is safe. Remember, a consumer's medical information must be kept confidential. Share details only with the care team. You'll learn more about this in the next module. Let's see if you understand what to observe and report. Read the statement and decide if it needs to be reported. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement and decide if it needs to be reported. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement and decide if it needs to be reported. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement and decide if it needs to be reported. If you need more time to complete the activity, make sure to press the pause button before time runs out. There could be times when you need to document your observations. It's important to remember that anything you document becomes part of the consumer's record and is considered confidential. There are state and federal laws that provide rules for how a consumer's records must be handled. Your agency or employer may have rules regarding documentation, including how, when, and what you do when information needs to be in writing. In fact, some employers may not allow HCAs to document in writing. It's important to understand and follow your employer's documentation policies and procedures. These are some general tips to follow when documenting. First, remember that documentation is confidential. Always respect a consumer's right to confidentiality by never leaving documentation where others can see it. Write clearly so others can read your writing. Describe what you observe clearly so that someone who was not there will easily understand. When documenting, write only what you see. These are called observable facts. Leave out your personal opinions and interpretations of what you think happened. Do not document or sign documentation for something that you did not do or see done, because what you write becomes a legal document. One of the tips was to describe only what you see. When you write down only the facts, this is called objective documentation. Objective documentation includes who was present, involved, or notified about what was happening, what the facts are, what you did, and the outcome, where you observed the event, when, date and time you made the observation, and how long or how often it happened. Even if you don't write anything down, when you report your observations, you should be objective. Objective reporting is the most helpful to the care team, as it helps them assess the consumer's change from baseline. When reporting objectively, use the consumer's exact words. This is the most professional way to report. Here are some examples of objective documentation and reporting. Mr. Chang said he has been sleepier than normal for the last week. Ms. Orloff fell at 3:10 p.m. Mrs. Rodriguez has a red patch on her left hip. She says it appeared last night. Mr. Brown began throwing things at me at 12 p.m. He said, "I don't want you here." Ms. Yusuf asked me what time President Kennedy would be on television. She asked 2 times in the morning and once in the afternoon. Subjective documentation or reporting is when you write or share your personal thoughts, feelings, or interpretation of an event. Subjective information may not be accurate, as emotions and feelings may be biased or can influence what you see. You might not have all the information or understand the event, which leads to inaccuracies. The care team may not be able to assess the consumer's change from baseline when subjective documentation or reporting is used. Here are some examples of subjective documentation and reporting. Mr. Chang appeared drowsy this afternoon. Ms. Orloff seemed scared about falling. Mrs. Rodriguez seemed concerned about a rash on her hip. Mr. Brown became angry at me. Ms. Yusuf seemed confused. Do you see the difference? These statements are interpretations and not facts. Always report objectively. There are times that you should try to solve a problem with a consumer before reporting it to the case manager or supervisor. Problem solving is a process used to deal with difficult or complex situations. The goal of problem solving is to overcome challenges and find a solution that best resolves the issue. Use problem solving when the consumer makes a poor choice, such as wanting to eat sweets while on a diabetic diet. The consumer refuses care, such as wanting to skip meals. If there is a safety hazard concern, such as poor lighting on the stairs, or when you are asked to do something not in the care plan, such as painting the consumer's house. Unless the consumer is in immediate danger or is putting someone else in danger, the consumer should be in control of their care. This is why we use problem solving. There are 4 steps in the problem solving process. Step 1. Explain. This is where you identify and explain your concern to the consumer. Ask the consumer to identify and explain their concern. Step 2. Offer safe alternatives. Here, you work with the consumer to come up with options together. Remember, the consumer has the right to choose. Then act on the decision and ask the consumer if it's working. Step 3. Report. If you and the consumer can't find a safe solution together, report the concern to the case manager or supervisor. Call 911 if someone is in immediate danger. Step 4. Document. Document the name of who you reported it to and the date and time. You'll learn more about problem solving in basic training. In this lesson, you learned that the observe and report process is how you watch a consumer for changes in baseline, and you report those changes to the case manager or supervisor. Report changes in physical, mental, or emotional health. If the consumer is in immediate danger, call 911. Some agencies or employers may ask you to document these changes in writing. Since documentation is part of a consumer's record, it must be kept confidential. To be helpful to the care team, documentation and reporting should be objective, or reporting only the facts. Remember to check with your agency or employer to learn its policy for documentation. There are times you may not need to report concerns if you can problem solve with the consumer. This means working with the consumer to find safe options. Read the statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement, then choose the best answer from the choices. If you need more time to complete the activity, make sure to press the pause button before time runs out. Read the statement, then decide which answers apply. If you need more time to complete the activity, make sure to press the pause button before time runs out. In this course, you learned how to describe the different types of consumer an HCA might support, describe the places a consumer could receive care, identify the basic job responsibilities and performance expectations of an HCA, describe what a care plan is and how to use it, identify members of the care team and describe how they work together and use the observe and report process to report changes in a consumer's baseline. Congratulations! You are now finished with Part 1 of the Orientation and Safety course. The next module, Consumer Rights and Communication, will explain consumers' rights and show communication techniques.